Hello, everyone. My name is Dr. Jacqueline Linder, coming to you from my home in Edmonton, Alberta on May 16th, 2020. I want to say thank you, a special thank you to Vladimir and the Tomorrow People team for working so hard on the Bali 2020 conference. I traveled all the way across the world. I made it all the way to the airport in Kuala Lumpur. I was about to board a flight to come to Bali when I was denied entry as a result of COVID, and eventually ended up being one of thousands of Canadians who was repatriated on emergency flights back to Canada a few weeks later. So I want to say thank you to the organizers for giving me this opportunity to share some of my data and some of my work with you in a virtual setting. I will be at next year's conference face-to-face, wherever in the world it is. I will be there so that I can continue to have a conversation with my colleagues about the data that interests me. So in terms of my personal history, I am my personal professional history, I am a complex PTSD specialist. So I work almost exclusively with individuals who have severe histories of childhood trauma, adverse childhood experiences of many kinds. I work a lot with first responders clinically. I'm a registered psychologist in both the provinces of Alberta and Ontario in Canada. And I have a subspecialization in the area of human trafficking. I work quite a bit with individuals, primarily females, who have been sex trafficked. And I've also worked quite a bit in my career with individuals who have been molested. So my doctoral dissertation was actually focused on looking at soul loss, which is a particular area of interest of mine, because my first degree is actually in sociocultural anthropology. When I studied anthropology, I came across the term soul loss, which is well known in the anthropological literature as a way of describing how human beings manage their distress. So there are cultures in the world where what we would consider in the West to be clinical depression, other people would talk about as soul loss, or the spirit leaving the body or being taken away or going away. And in my doctoral dissertation, when I was studying, I did a qualitative research study with 12 survivors of childhood sexual abuse. When I was studying them, there was a very interesting thing that emerged from the data was the parallels. There's a lot of parallels between the Western conceptualization of major depressive disorder, as well as psychological dissociation, primarily in the depersonalization, derealization ranges. There's a lot of parallels between the clinical symptoms that we have in the West and what other cultures have talked about as a spiritual or a spiritual, psychospiritual illness. So my work, my dissertation work that was finished in 2014 was really about how do I build a bridge between the Western clinical model of complex trauma and this other information I was hearing from my clients who talked about their soul being sick or their soul having died or been murdered as a result of the trauma that they had experienced. One of the defining aspects of complex trauma is that it's in most cases some kind of interpersonal violation. So it's a form of trauma where one human being does something really awful to another human being. And Judith Herman, in her book Trauma and Recovery, talked about how certain violations of the social compact are just too terrible to be uttered aloud. And this is the meaning of the word unspeakable. So working with clients who would talk about feeling like they were empty at their core, I got more and more interested. And as a researcher, I wanted to understand more the psychospiritual injury that complex trauma can cause. So my dissertation identified a range of soul loss with 6 nodes going from soul wounding to soul murder, with stages in between that basically talked about the level of injury that had been done to the survivor. I then extended that research. I was continuing to work in complex trauma. I was doing more and more work clinically with survivors of human trafficking. I became very interested in what were the implications of psychospiritual injury in human sex trafficking. It's another profound form of violation. It's filled with betrayal, it's filled with violence, it's filled with pain and loss. And a lot of individuals who end up being trafficked have pre-existing adverse childhood experiences in their history. So the study that I have just completed, and I'm still working on the findings for, and some of the preliminary findings I had planned to present this year in Valley 2020, showed that it's very, very clear that human trafficking absolutely leads to psychospiritual injury in many survivors. So in my study, I interviewed 24 individuals. 8 of them were survivors of human trafficking. 8 of them were police officers who rescue survivors of human trafficking. And 8 of them were frontline social workers who support survivors of human trafficking once they're rescued. A lot of very rich data has come out of that study, and I will be presenting more on the findings that emerge from the study next year when we do the 2021 conference in person. For the purposes of this presentation, I actually want to talk a little bit more about the method and ethics that were involved in the study and how that impacts the person of the researcher. So in my personal history, I became a trauma specialist because I have my own complex trauma history. From a clinical perspective, when a therapist has a complex trauma history of their own, we always have to be aware of something called countertransference, where we're making sure that our own personal history and our own personal material doesn't intrude on the work that we're doing with our clients. Now, intuitive inquiry is a very unique qualitative research method that has 5 stages. And one of the things that became very clear from the work that I did with human trafficking is that the researcher has to be quite careful, depending on their background, depending on the method that they're using, depending on the topic they're addressing and the population that they're working with. The researcher has to be very, very careful about how they will be affected by the study. So intuitive inquiry has 5 cycles. Cycle 1 is where you clarify the topic, bring that into focus. There's wonderful complementary, artistic, and somatic, and intellectual, analytical ways that you can do that. Lots and lots of creative, scholarly space to figure out exactly what the research question is going to be. Then in cycle 2, the researcher wants to sort of drill down and try and identify any preconceived biases or lenses that they're going to bring to the study, because we don't want this loop where the researcher has a bias and then they go and they do the work, they do the data collection and so on, and they just reconfirm the bias. The whole point of research is to extend our knowledge and try and find something new. So it becomes very important in this process for cycle 2 to get very, very clear about what the researcher's pre-data collection biases are. Then in cycle 3, we go into a data collection phase, which in my case involves 24 long form interviews. Most of the interviews ran between 45 minutes and 60 minutes, sometimes a little longer, depending on the participant I was interviewing. Then there is in cycle 4 a data analysis phase, and post collection lenses are developed, and then we compare and contrast the lenses from cycle 2 and the lenses from cycle 4 to see what has changed, what assumptions the researcher brought in, what they discovered, and the ways that the data collected confirmed or challenged those assumptions. And then cycle 5 is sort of an integration, the discussion phase of the findings and extending of the findings into theory. One of the things that became very clear when I was working in this study was, because intuitive inquiry is a qualitative research method that is extremely deep, there were some unexpected risks that came up for me as a researcher in the study, despite the fact that I am a trauma specialist and a licensed clinician in 2 provinces. So one of the things that happened, which was very interesting for me and a little bit alarming, was when I did my data collection phase, going through cycle 3, I had no issues identifying my topic. I had no issues identifying my biases. That was the easy part. As I began the data collection phase, I also had no issues in terms of interviewing participants, listening to the stories, because when you're a therapist, we listen to stories all the time. That's actually our day-to-day life. So if you happen to be a therapist who's also a researcher, and you're a therapist who's a qualitative researcher, there's some benefits there, because we are in the chair with individuals all day long, hour after hour, week after week, month after month, year after year. So our ability to sit and listen carefully to what someone is telling us is very, very high and lends itself quite well to qualitative data gathering. However, there are some differences I found on the research side that didn't come up for me and doesn't traditionally come up for me in my clinical work. So when I was going through the data collection process, the stories, because of the topic, were incredibly powerful. It was so powerful to sit with survivors of human trafficking who had been through unimaginable trauma, unimaginable loss, unimaginable violation. And they still found a way to flourish. It was even more moving for me, who works extensively with first responders. I work with one subsection of my caseload is almost exclusively police officers and firefighters. And in the study, I happened to interview 8 police officers who were all male, who worked almost exclusively with female victims, female survivors. And the level of compassion that came out in the interviews, the level of unconditional positive regard that these police officers had for the women that they had rescued, and the level of concern and in some cases shame that many of them described, because in this particular study, all the police officers were male and all the offenders of my participants were also male. So we had this tension between the men who had harmed, the clients who had harmed, the handlers, the traffickers who had harmed these 8 participants, and then the men who had rescued them. And it was very interesting to look at the data from the survivor's perspective and the police officer's perspective and see the tensions, the gender tensions that were actually part of the process. So that all went fine. The interview phase went just fine. So I did one round of interviews. Then I did another round of just reading all the transcripts. Then I did another round of sitting and reflecting, taking notes. And then something really interesting happened. I felt very stuck in the work, which was confusing for me because it's a wonderful topic. It's so rich, and I couldn't understand what was happening. And so I had a conversation with Rosemary Anderson, who is the founder of Intuitive Inquiry, and her recommendation was that for my last round of analysis, that I listen to the audio recordings rather than read them yet again. I listened to them while I did the interviews. I read them one transcript at a time for round 2. I read all of the transcripts for round 3 and then collated them into themes. But I still felt like I wasn't getting to the depth of what was happening. And so for my 4th round of analysis, I decided to just listen to the actual raw audio, freestyle, as I was driving, as I was cooking, as I was cleaning, as I was gardening, just going about my life, just taking it in. And I found very, very quickly that I became completely emotionally flooded by the data. And that was a surprise for me. I had not expected it. I have been working in trauma, either as a volunteer, as a licensed clinician, as somebody who's recovered from my own trauma history for many, many, many years, it never occurred to me, nor have I experienced this before. It didn't occur to me that I could be completely overwhelmed by the emotional content. But what people were talking about was trauma, betrayal, shame, helplessness, violations of dignity. The topics were very hard. But I think what was most overwhelming for me was actually the bravery, the raw, bitter courage of the survivors themselves, and the profound empathy and sadness, the sorrow, the deep sorrow that the police officers and frontline workers expressed towards the survivors they've worked with in their careers. There was something just incredibly moving that came out of that. And very quickly I found, after going from a very heady intellectual phase of data analysis, I found myself underwater. And many of us have done presentations at other conferences before. Many of us know images of the iceberg idea, where you have stuff that's above the waterline and stuff that's below the waterline. And somehow listening to the data rather than reading it took me right below the waterline, and I felt like I was emotionally drowning, which surprised me. So I put an immediate hard stop on data analysis of every kind. I turned off my recordings. I stepped completely back. And then I had to figure out how I was going to finish the process of the fourth cycle of data analysis without being completely overwhelmed myself as a researcher. One of the things that I realized, which I hadn't known before, was that listening to the interviews and reading the interviews for a researcher are completely different experiences. The reading is very sort of, it's safe, it's tight, it's somewhat distant, it's heady, it's contained. The listening to the actual interviews, unfiltered, seemed to involve my entire body, like all of me, not just my intellect, but my whole selfhood seemed to be drawn into the process. And I found that initially it was just too much. I could not metabolize the emotions that were coming at me or the emotions that were rising up in me as I was trying to get a handle on this data and what it all meant. And in qualitative research, there's always layers that you're trying to peel back, and I couldn't peel anything back because I seemed to be dropping like a stone just into feeling. So I moved very quickly to working on regulating my nervous system. My sense is that there's some kind of, especially in qualitative research, there's almost a magic bubble that occurs between the participant and the researcher. That's very much the case in the clinical side. That rapport that can happen between therapist and client. Qualitative research invites a similar rapport between the participant and the researcher. And I realized in hindsight that relationship, there is a relationship, there's an exchange between the researcher and the participant, depending on the method you use, the approach you take, the topic that you're covering, and the background of these two individuals. And I describe that as this magic bubble. And what happens between those two individuals, I actually think is a really important part of the data set. I don't think it's just the words that are part of the data set. I think it is the emotional field that is created in the researcher participant dyad. I think that's a very important part of the data set. And to my surprise, despite my tremendous experience working in complex trauma with very difficult topics with extremely harmed individuals, it was actually too much for me. So I had to stop. I had to pull back. I had to regulate. And I moved very, very quickly to how do I ground myself in the face of this data, because I wanted to give each of the 24 interviews my full presence, my full attention. I wanted to receive the story. I wanted to receive the experience that the participant was offering as deeply as I could, but I needed to personally regulate myself in order to be safe in the work and to do it justice. So I spent lots of time doing lots of yoga, grounding, gardening, doing very physical things, working out, lots of cardiovascular exercise. And then I also limited the amount of contact that I had with my data. So I would never work on more than a single recording in a day. It was just too much, and I needed time to pull back and recoup and rest, reflect, journal, et cetera, to see what else was coming up for me. Overall, I found the data analysis in its fourth phase to be one of the most taxing things that I've done in a very long time, both emotionally as well as intellectually. Because as I moved deeper and deeper into my emotional resonance with the data, immersed myself deeper than I ever had before, which is an obligation of a qualitative researcher, new things started to emerge for me. And one of the things that I realized is I wasn't sure I had signed up for this. So we talk a lot about the ethics of protecting the participant. But my experience led me to believe that we need to talk a little bit more about the ethics of protecting the researcher. Because depending on the topic that you're studying, depending on the state of mind of the researcher, depending on the method being used by the researcher, which in my case was intuitive inquiry, we think we know what we're getting into as a researcher, but I'm not convinced that that is the case. I found myself already halfway into the process of research when I felt myself to be at risk and had to shut down the research and stabilize very, very quickly before I could continue the work. That is not what I had signed up for. I thought that I would just move very smoothly into this classic data collection, standard interviews, classic thematic content analysis, and that I would be fine. And that is not what happened at all. And so when I look back and thought to myself, well, we always ask participants, are you sure you want to do this? Are you sure you want to continue to do this? When I asked myself, am I sure I want to do this and continue to do this? The answer was, I actually don't know. This is a wonderful topic. It's a wonderful method. It's a wonderful discovery. There's a lot that I can offer to the world with my work. But what is its impact going to be on my well-being? Because I felt like I had to do the data justice. This is a study on soul loss. I felt like as a researcher, I had to bring my whole soul, not just my intellect, to the work. And that made me very vulnerable in ways that I had not expected, in ways that I hadn't planned for, in ways that I had not safeguarded. And so the reason I had to put a hard stop in the middle of the process until I came up with some new stabilization plans is because I had no plans. I assumed I knew where the journey was going to take me, and I was completely wrong. So that was a huge learning for me. I safely, in the end, made it to the other side. I safely went through, fully embodied and ensouled. I met all 24 of the interviews again in an auditory way. It turns out there was so much I had missed in terms of data when I came at the data initially only from an intellectual place. So I'm very glad that I did it again and went deeper and deeper. But I also learned that as I continue on my path in qualitative research using intuitive inquiry, I'm drawn to topics of trauma. I'm drawn existentially, spiritually, to human suffering and healing and resilience and heroism. I'm drawn to those heavier topics. And so I can anticipate that I will do further studies of this nature. And when I return, when I finish writing the book that I'm working on about this study, and when I return to a new study, one of the things that I will bring with me is a new understanding of my own humanity, my own frailty, my own vulnerability, my own emotional potential unreadiness to fully meet that which my participant is offering. I recognized also that when I did my dissertation, I had a supervisor who served as an anchor for me. As an independent researcher who finished her PhD 6 years ago, I actually don't have a supervisor anymore. And so I didn't have an anchor. And that might have been one of the reasons I felt like I was free falling into the data in a way that I wasn't prepared for. So I learned a lot, not just about soul loss and heroism, but about who I am as a researcher and what I need as a researcher. And one of the things that I need is to reflect very carefully and very deeply and very soulfully on the kind of research questions that I'm asking, who I'm asking them of, and how I will proceed in my future work in a way that does allow me to get into these deeper layers of human struggle and resilience, but also doing it in a way that is safer for the person of the researcher. I want to thank you all for listening to this webinar. I look forward to seeing all of you next year at the 2021 conference. There's so much fascinating data that emerged from this study that I plan to talk about when I see you all face to face. In the meantime, be well, and I look forward to seeing your virtual presentations. Bye.